have a 16, that's also gonna be on the, final.
Yeah, I don't think we're gonna talk a whole lot about 16, I'm gonna look at it when we get done with class. It's very short. Okay, so the separation of whole blood into its parts or its different components allows for the optimal storage of each part. And so, you know, there's the red blood cells, the plasma, cryoprecipitate, and platelets. And so, you know, platelets are stored at room temperature. We were at one of the blood banks when we were visiting the clinical sites, and they were talking about they only had like one platelet left on the shelf, and somebody said, "Oh, do you just get more out of the freezer?" And so I know that person will not ever forget that now. Platelets are stored at room temperature. Remember, they only live for like 7 to 10 days. I thought that the constant agitation was to keep them from sticking together, but that is not it. It helps with their metabolism. So, you know, they're still using glucose, and there's a metabolic exchanges going on in there. So that's what the agitation is for. So I don't know everything. I'm still learning stuff with y'all too, stuff that I forgot. So blood is collected into a primary bag that has the anticoagulants and the preservatives. So the preservatives are what keeps the say for red blood cells, what keeps them alive. So they still need glucose. They are a living, technically, like an organ. Oh, you wanna hear a sad story?
Yes.
Okay, so one of my friends needs a liver. He has non-alcoholic liver cirrhosis. They have 2 very small children, and he's got some older kids too, but he needs a liver. UAB called, he's been on the transplant list. UAB called over the weekend. They had a liver, you know, a liver, unless you're getting a piece of a liver, the donor has to die to get a liver. So he's been waiting on this liver, and they called him, said, go to UAB. So they threw their stuff in the car and rushed up to UAB to get his liver. The pump, you know, livers are the number one transplant that uses the most blood during a surgery. So they had the liver on this pump to keep it alive, like with blood, you know? The pump malfunctioned and the liver died before they got there.
Oh, man.
I have never heard of anything like that before in my whole life. Ain't that so sad?
That's terrible.
You can't sue, but I'm sure they'll look into whoever manufactured the pump, whatever that even looks like. But I thought that was just traumatic. I mean, so sad.
Where did he work?
Primary on the donor list? Kinda sucks, you have to wait for some.
Say it again.
When you say higher from the donor list, my dad, it has something happen to my dad with his kidneys. He
That's
had a
so
kidney
sad.
transplant in the-
Yeah, so I'm sure he'll stay wherever he's at on the list, but that is so sad.
Where did he work, by chance?
I think he's a contractor,
Ooh, okay.
but anyways, so sad. So it has to be done at a transplant center. I think UAB might be the closest. I think Ochsner does some transplants, but wherever his doctor is or whatever, yeah, that is far. So usually they'll fly an organ, because you know, you have so many hours to transplant it. Anyways, that was so sad. Okay, so blood's collected into the primary bag, and the collection set is sterile, and that's considered a closed system. So once the blood is collected in the bag, you know, it has ports where the nurse opens the little thing and sticks the plastic IV thing in there so that the blood can come out. So once you open one of those ports, it becomes an open system. And so if the ports or other areas are exposed to air, the system becomes open. And that changes the expiration date. So usually within 24 hours at the most, the product will have to be used. So y'all can read about the anticoagulants and the preservatives and what they do. I'm not gonna read that whole chart to you. So these you need to know, especially for your board. I don't think I asked you any of these on the test, but you're gonna have to know these for your boards. So CPD has a 21-day expiration date. CPD 2, 21 days, CPD A1, 35 days, and then they add some of these additive solutions up to 42 days. So your LSU book is gonna have a little chart in there that makes it easy to remember the expiration date. So whole blood is centrifuged at a light spin, and that leads to platelet-rich plasma. So if you do a heavy spin, it gets all the platelets out. And so they do a light spin, and the platelet-rich plasma is expelled into a satellite bag, so a separate bag that's attached. And then an additive solution is added to the red blood cells, followed by leukoreduction. It says optional. Our hospital only received leukoreduced, so your blood center will have a contract with your hospital as to what products you'll receive. I've never seen a unit that wasn't leukoreduced, but if they did, it's more expensive. So if they did do it that way, there's special filters you can get, and you transfuse it through the special filter that can remove leukocytes. And so you can read over the contract. I never read the contract until I became a supervisor, because I didn't need to, but all that stuff will be in the blood bank. If you get just bored to death, you can read it. The plasma can be further processed as fresh frozen plasma, which we just call FFP. And then the FFP can be processed into cryo, and so we'll talk about in a minute how they get the cryo out of the FFP. And the cryo is just like a concentrated coagulation factors. So this component storage, you can go back and look at it, but you're gonna have to know them. So whole blood is stored at 1 to 6 degrees for storage. Shipping is at 1 to 10 degrees. Frozen red blood cells, less than or equal to negative 65 degrees. So really, really cold. Irradiated red blood cells, so most red blood cells, the expiration date is 42 days. That's because they want it to last as long as it can on the shelf. Once it's irradiated, it's only good for 28 days from irradiation or the expiration date, whichever is sooner. FFP is stored at negative 18 degrees for a year, but it can be good for 7 years if it's less than negative 65. A regular blood center, blood bank is not gonna have a freezer that goes to negative 65. Platelets, 20 to 24 degrees, so that's room temperature. So just be familiar with that chart. So before the development of this blood component preparation, whole blood was all there was, because they didn't know how to do it. And so in the 1960s, plastic replaced the glass collection containers. All they had was glass in the beginning. And then that allowed them to separate the whole blood into its components. But it started out as just whole blood. And so whole blood has all the components. It has plasma, platelets, red blood cells, all the clotting factors. It's indicated for patients who are actively bleeding or undergoing exchange transfusions. So this right here, I can't remember if I told y'all this before. 1 unit increases the hemoglobin by 1 gram, the hematocrit by 3%. That you do need to know that. Did we talk about that before?
It was a test.
That was
It was a test
a test well.
Okay, so we did talk about it. So you'll see it again.
I didn't
We
see
did talk
it
about
in
it,
the
but it was on the
PowerPoint.
test.
Oh, okay, so hemoglobin, and so the way I remember that is, like, hemoglobin, if you're saying H and H, like if you're measuring somebody's H and H, hemoglobin always comes first, then hematocrit. 1 comes before 3. And so you know hemoglobin is grams per deciliter. So that's how I remember it. That helps you That will be some sort of test question. Yeah. Whole blood must be ABO identical and cross-matched, because it has plasma in it, so the plasma antibodies has to be compatible as well as the red blood cells. So we just said that, the red blood cell components are indicated for people that are undergoing chemotherapy or irradiation, trauma victims, patients having surgeries, so cardiac surgeries tend to use a lot of blood. Not as much as they used to now that they have the cell saver that we talked about, the pump they put on where they wash their blood and give it back to them. End-stage renal disease, you lose some red cells in dialysis, and your kidneys, EPO is made by the kidneys, and so when they quit making it, so they have a kind of a double whammy there. Premature babies, sickle cell patients, thalassemia patients, people that have anemias. So leukocyte reduced red blood cells, that's all we ever used, and I never used whole blood either. Reactions to leukocytes can cause fever, shaking, and chills. It can be extremely uncomfortable for the patient. Cytokines are produced by leukocytes, which can cause febrile reactions, so cause a fever. And an inline filter is used to remove leukocytes before storage. Leukoreduction also removes CMV virus, which resides in the cytoplasm of the white blood cells. This is important. I want you to remember it forever. Removing leukocytes does not prevent graft versus host disease. So even though it's caused by the leukocytes, leukoreduction doesn't remove enough to prevent graft versus host disease. So the final unit must contain less than 5 times 10 to the 6th white blood cells. So apheresis red blood cells, so it's an automated collection, so you can give 1 unit every 8 weeks or 2 units every 16 weeks. We call those double reds. Saline replaces the lost fluid in the donor, so it prevents volume depletion. And then the final component must have at least 51 grams of hemoglobin. Double units, so they'll be collected into a big bag. Double units will be separated into 2 units. Frozen red blood cells. So there's a high glycerol method and a low glycerol method. This is the main one that's used. That one's rare. And you don't really have to know that. So initial freezing is at -80 or at -65, and it can be stored for up to 10 years. And so a test question, you need to know that the minimum storage is -65 degrees for frozen red blood cells. Minimum -65 degrees. So deglycerolization, they add the glycerol to these frozen units to maintain the inventory of rare units. So like say if it was a Bombay patient that wanted to donate to himself, herself, they could freeze the units. I'm sure it's very expensive to freeze units for yourself. Glycerol is a cryoprotectant, so it prevents red cell dehydration and it prevents the formation of ice crystals in the bag, both which can cause hemolysis. And if you've ever seen glycerol before, it's just a thick, clear, it looks like water, but it's very viscous. It's a thick, clear liquid. So after thawing, the units are washed with a series of saline solutions to remove the glycerol. At that point, when the saline has been added to it, you've entered the bag it becomes an open system and it expires in 24 hours. So usually, if you're ordering one of these rare units, you call your blood center, and if they need to, they'll contact the rare donor registry. They'll thaw one of those units out, wash it until all the glycerol is out of it. Then you have, say they're in, our reference lab was in Gainesville, Florida, which is like flying distance away, right? And so they would wash it, throw it on a plane, and try to get it to us, like say if we ordered in the morning, we would try to have it by midnight. And then you have to retype the unit, cross-match the unit, and so your time frame there starts getting pretty thin. And so it's a rush to get blood to the patient because of the very short expiration date. So it has to be, the transfusion has to be completed within that 24-hour window. Okay, washed red blood cells are washed with normal saline to remove plasma proteins that can cause allergic, febrile, or anaphylactic reactions. So any red blood cell can be washed. And at that point, it also has a 24-hour expiration date. Who can tell me a reason why you might need to wash red blood cells to remove these plasma proteins? Y'all remember when we talked about? That can be anaphylactic? Yeah, IgA deficient patients. And so it only matters if they've made an anti-IgA through maybe exposure. And so the doctor would order a washed red blood cell. I've only seen that done one time, but it does happen. So this is the machine that they're deglycin, it's called deglycin is what we called it. And so here's the unit, and there's the saline, and it's putting it together into this machine, and it washes on, pulls the saline off, and then it'll put some more saline in there, pull it off again to literally wash the glycerol away. Okay, irradiated red blood cells. We've talked about them so many times because it is traumatic to me. So, irradiation prevents transfusion-related graft versus host disease. You need to know that. Graft versus host disease is a reaction toward HLA antigens on T cells. Red cells and platelets must be irradiated if the unit is from a blood relative, so a closely related donor, or if the patient is immunocompromised. So I'm not gonna ask you about the doses, but the lowest dose that can be used is 1,500, is that gamma rays? I don't know how you say it. Irradiated red blood cells have an expiration time of 28 days, if it has at least 28 days left on its expiration. So according to your book, transfusion-associated graft versus host disease is fatal in more than 90% of affected patients. So it's very important that the doctor orders it irradiated, that you give them irradiated products. Platelets. Skip one. So platelets maintain the vascular integrity. This is just a review, right? They initiate formation of the platelet plug, stabilize the platelet plug by contributing to fibrin formation, and the indications for use, people that are on chemo or radiation, post-hematopoietic progenitor cell transplants. So, you know, they wipe your bone marrow out if they're doing a transplant. And until, after they do the transplant, until your body, until those cells graft and start making more cells, then you may need a transfusion or several until your body starts making enough. And then they can use them in post-operative bleeding. Platelet concentrate should contain at least 5.5 times 10 to the 10th platelets. 1 unit increases the platelet count by 5 to 10,000. Pooled platelets are considered an open system, and they expire in 4 hours. So sometimes you'll see platelets that come in 2 bags. They're connected by like a tubing. but there's two of them. And so the tubing will be clamped off. Well, when you get ready to issue it, you can pop those little plastic things and you hold one up and it drains into the other bag. And that's how they transfuse it. Well, back in the day, we pulled them in the blood bank. So we would literally pop those little plastic things, I'd hold one up when they came to pick it up, drain it into the other one, and then I had a pair of scissors and I would literally cut the line. And then I had a little plastic clip and a tool that looked like, I don't know, like a wrench or something. And you would clamp that little piece down on there and that kept it from leaking. And then they would have 4 hours to transfuse it because it expires in 4 hours after you pull them. Well, the blood bank was really, really busy one day, and I was working in another department, and I saw somebody standing at the window to pick up a blood product. And I was like, I wasn't super busy, I was like, I'll go, I can issue, that won't take me but a second. So I went in there, and I got ready to issue it, and I cut those units apart before I pulled the one into the other one. So here I am, holding 2 bags with a piece of tubing that's just hanging. I had no way to put that one platelet into the other one. We only had a couple platelets on the shelf. A platelet cost $500, and I'm standing there. They're so busy, nobody even knows what I've done yet. They can't stop what they're doing to help me. I knew that was probably my last day to work in blood bank. So embarrassed. So the blood bank never pulled another platelet, that's for sure. The nurse did it when they got up to the floor, so I ruined it for everybody. So anyways, if you do pull platelets in your blood bank, make sure you put them into the same bag before you cut them apart. Don't do what I did, learn from my mistakes. It's very embarrassing to do something like that. Okay, so pooled platelets. So pooled platelets is multiple units from different donors. Apheresis platelets are known as single donor units. They do this a lot now, and it helps with the patient not being exposed to all these different HLA antigens too.
Do they do compatibility testing on pooled platelets?
No,
Because it normally doesn't matter.
no. But they will pool platelets of the same blood type, so if all the donors would be A if they made a pooled platelet, right, or B or
That's what I
whatever.
was looking for.
Yeah, so no compatibility testing as far as like cross-matching with the patient, which can be done in certain cases if the doctor wants it to be done. And platelets are leukoreduced to help with the HLA alloimmunization. And so apheresis just means that the donor gets on that machine where they pull all the products off, and then they separate the platelets and give them their red cells and their plasma and stuff back. FFP, which is fresh frozen plasma. FFP and FP24. So this is plasma frozen within 24 hours of phlebotomy. And you don't really have to know that, in case you just want to know what it means. So both of these products contain all the coagulation factors. They say that the PF24 may have less factor VIII, but they use these products the same way. So if the doctor orders a unit of FFP, you're just gonna grab one off the shelf and use it. So these are used the same way. And so if they ask you a question on the test about it, PF24 may have less factor VIII because it sits out longer before it's frozen, but they're used the same way. It just may have a little less factor VIII. So FFP is indicated for patients needing factors 2, 5, 10, or 11 when concentrates are not available. So they make factor concentrates for people with factor deficiencies for these factors, a lot of the factors. That's used for people that have abnormal coagulation assays from mass transfusion, patients that are taking warfarin who are bleeding. So you'll issue a lot of FFP to old people that took too much of their medicine. And so they can correct some of the warfarin, because remember, it's a vitamin K antagonist. So if it's not too bad, they can give them some vitamin K and it'll correct itself. But if they took way too much, then they'll give them some FFP to try to correct it. It's a replacement solution for therapeutic plasmapheresis. Those will drive you crazy because they'll usually use like a 3,000 ml volume, which takes about 10 bags. So you'll have to thaw them all out, and you can only thaw a few at a time. And then you have to add up, each volume will be on the bag. So you have to literally get, I would get a piece of paper, take the sticker off the back. This one has 300 mils in it. This one has 254 mils in it, and add them up until you get to 3,000, and they'll do this in people with like TTP every other day I've seen it go on for months. So plasmapheresis is a lot of work, but it helps get the levels of the antibodies that are causing this, whatever this autoimmune disease that they have is, and helps correct their problem. FFP is used for patients with liver disease. Liver disease, you know, your liver makes your coag factors. So most people with liver disease have factor deficiencies, and FFP can correct it. And then people with DIC when fibrinogen is low, so less than 100. So what's the lower range for fibrinogen, y'all remember? 150. So just put that in your brain. In case you see it on your boards. So plasma and cryo is thawed in a water bath. Some of y'all got to see a water bath at the hospital. And so they put the units in a plastic bag to protect the ports from the water in that bath. And so the water is supposed to be changed at least every month. But still the water is not sterile. And so you don't want the water getting in the ports. So there may be something on the test about that. Those plastic overwrap bags are just to protect the ports of the bag from getting that water in it. That's what the bags are for. Prevents bacterial contamination. I even read about this, a microwave that they've come out with that can thaw cryo and FFP. But I don't really know anything about it. Can't do it in a regular microwave because it'll cook it. And if you cook FFP, for real, it looks like egg whites. Because albumin, you know, there's a lot of albumin in an egg white. Well, if you overcook a unit of FFP, it can look the same way. So the rules is 30 to 37 degrees for thawing FFP. You don't want it to be any hotter than body temp. It thaws in 30 to 45 minutes, but most of them now have an agitator, and so it's something that just does it up and down while it's thawing, and usually you can do it in 15 to 20 minutes. It's stored at the same temperature as blood once it's thawed out, so you put them in the refrigerator, and it must be transfused within 24 hours. If your facility labels, you can relabel it as thawed plasma, and it can be stored for up to 5 days. We didn't relabel. And so after 24 hours, we threw it away. And so they're cheap. They cost $60-something. I think AB costs like $75. So this thawed plasma, factor 8 is one of the Laval factors. Remember that? And so that just means that it doesn't last long in the bag. And so it can't be, you have a factor 8 concentrate. They are expensive. But if you are trying to treat a factor 8 patient that you don't have any concentrate, you wouldn't want to use this thawed plasma. Plasma should be ABO compatible. And you don't have to know the back of the replacement thing. So cryoprecipitate is cryoprecipitated anti-hemolytic factor. So it's just concentrated coag factors. So cryo is the cold precipitate that forms when FFP is thawed at 1 to 6 degrees. So they freeze the units, and and then they thaw them out in the refrigerator, and as it thaws out, those concentrated clotting factors precipitate out. They remove those, and then they refreeze it. So that's how they make cryo. Cryo comes in a little bitty skinny bag, so it looks just like plasma, but it's a little bitty bag. So cryo is frozen, refrozen within an hour, and it's stored at -18 degrees for up to a year. It has to have at least 150 milligrams of fibrinogen. And so remember that, 150 is the range, it has to have at least 150 milligrams of fibrinogen. I think the range is actually 150 to 400, but the lower limit is 150. So cryo contains the von Willebrand factor, fibrinogen, factor 8, fibronectin for wound healing, and factor 13. So have you ever heard of that fibrin glue that they use in surgery? So they make a fibronectin concentrate, and I think it comes in like a little syringe looking thing. They have it in surgery. So I've never seen it in real life, but that's what it's made from this. Cryo is a secondary treatment for hemophilia A and von Willebrand's. And so since this is the secondary treatment, those factor concentrates is the primary treatment. I read one time how much it costs to treat, say, somebody that has a factor 8 deficiency over just a year's time. It is very expensive to get these factor concentrates. And cryo is the only concentrated fibrinogen product available. So once it's thawed, it's stored at 6 degrees. I don't think that's true. I'm not gonna ask you that. We stored our cryo at room temperature, so I think that's wrong. So don't worry about that. Well, I'll read about it in the book. Okay, so pooled cryo is kept at room temperature and administered within 4 hours. Yeah, that's not true. So don't, mark that out. I didn't catch it last night when I was reading. So it's kept at room temperature and administered within 4 hours. So for some reason it can't go on the platelet agitator, you know, platelets are at room temp. So I took a command hook and stuck it on the inside of my platelet incubator, and there's a hook, like a hole in the top of the bag where they hang them on the IV holes. And so I would just hang them on the inside of that incubator until they came to pick it up. Since you only have 4 hours, I would call them after an hour or two. They usually only order cryo if they really need it. And so I'll be like, hey, are y'all coming to get this? What's the hold up? So just don't let it sit there and expire on your shelf. Oh, and this fibrin sealant, that's the fibrin glue I was talking about. So apheresis granulocytes contains leukocytes, platelets, and some red blood cells. And so the book says between 20 and 50 mils of red blood cells. You don't have to know that. Apheresis granulocyte transfusions are rare.